Namaste, मैं हूँ उर्वशी अग्रवाल, your integrative wellness coach. Today we will talk about diabetes. I feel sad to announce that India is world's diabetes capital. Almost 50 million people in India are suffering from diabetes. आज के वीडियो में हम बात करेंगे क्या होता है डायबिटीज, क्यों होता है डायबिटीज, what are the myths revolving around diabetes, what superfoods you can eat in your diet to reverse diabetes, what are the types of diabetes. What is diabetes? Diabetes is when your blood sugar in your hemoglobin is higher than the normal range. That time you're declared as diabetic. What happens is when your HbA1c, that is hemoglobin level of sugar, is more than the normal range, which is between 4 to 5.4. If it is between 4 to 5.4, you don't have sugar. But if it exceeds from 5.6 to 6.4, that means you have the tendency to develop diabetes in future. But if it crosses 6.7, that means you are declared diabetic. So what I would suggest is that you all should maybe once in a year or once in 6 months get yourself tested. There is no harm to know your levels. Once you know that your HbA1c levels are high, it is important to figure out which type of diabetes you have. Is it type 1, type 2, or gestational diabetes which women get during childbirth or pregnancy? See, I want to first explain you the whole process of diabetes, how it happens, what kind, what is the process. So, whatever food we eat is converted into sugar, and our pancreas, which has beta cells, produce insulin. So, it is the work of insulin to take this food to each and every cell of the body. आप इसे एक की एंड लॉक की तरह समझिए कि जैसे इंसुलिन वो सारे फूड को सेल्स के पास लेकर जाता है एंड इट डिस्ट्रीब्यूट्स टू ईच एंड एवरी सेल फॉर द वर्किंग ऑफ द बॉडी, फॉर ऑल द वर्क वी डू द होल डे. So, in type 1, what happens is that beta cells are destroyed because of any autoimmune disorder in our body. So, when there are no beta cells, the insulin production does not happen or happens very less. So, we need external insulin for the working of the body. In type 2, there is production of insulin happening in the body, but the cells, which are the lock, and the insulin, which is the key, whenever the insulin goes to the cell, the lock does not open. So what happens? That whole sugar which we had converted because of food keeps on flowing in our body, and then we get higher sugar levels. So that we called as insulin resistance. So normally in type 1, the diabetes happens before the age of 20, but type 2 diabetes happens after 30-35. And for knowing what type we have, if we have sugar, we need to keep on checking our sugar levels 6 months or maybe once in a year. I meet a lot of clients every day who have diabetes, who are on insulin or medication and feel that हमारे range normal है, we are off diabetes. See, if you need an external medicine to lower your range, to produce insulin in your body, it is not normal. You need to make lifestyle changes. You need to change your food, your habits to get off medication or reduce the medication and then see what your body does for you. Type 2 diabetes is easy to reverse, but you need discipline, you need a guidance to do it. The most common question and myth around diabetes is, क्या हम चावल खा सकते हैं? Can we eat fruits? Should I go off gluten? See, चावल, gluten, fruits, we say less to eat because the glycemic index is higher. जब भी आप ये खाना खाते हैं तो आपका शुगर लेवल स्पाइक अप हो जाता है. लेकिन जब आप इस खाने को फूड्स विच आर हाई इन फाइबर के साथ खाते हैं, जैसे दाल, हरी सब्जियां, तो उसका ग्लाइसेमिक इंडेक्स मेंटेन हो जाता है. So you can eat, but in right quantity, right proportion, and right combination. See, understand one thing. Type 1 diabetes happens when we have some autoimmune disorder. मतलब कि हमारे गट में कोई इश्यू है, हमारा खुद का ऑटो इम्यून सिस्टम हमारे पैंक्रियाज को अटैक करता है एंड इंसुलिन प्रोडक्शन नहीं होती. सो दैट इज डिफिकल्ट टू रिवर्स, बट वी कैन स्टिल बेटर इट. बट when you have type 2 diabetes, that is 100% a lifestyle disorder, which means is कि या तो आपने अपना न्यूट्रिशन का चेक नहीं रखा, यू हैव अब्यूज्ड योर बॉडी बाय ईटिंग अ लॉट ऑफ प्रोसेस्ड फूड, यू आर लीडिंग अ सेडेंट्री लाइफ जहाँ पे आपकी बॉडी में कोई मूवमेंट, कोई एक्सरसाइज, कोई वर्कआउट इंक्लूडेड नहीं है. उसके अलावा योर स्ट्रेस लेवल्स आर एट पीक. Stress is also one of the reason, and I would say the main reason for insulin resistance in our body. And last but not the least, sleep. You all know, and I have spoken about it many times, that जब आप सोते हैं आपकी बॉडी में रिपेयर वर्क होता है. योर बॉडी गोज अंडर रिपेयरेशन. लेकिन जब आप सोते नहीं, ठीक टाइम पे नहीं सोते, इनफ स्लीप नहीं लेते, सो आपकी बॉडी में लाइफस्टाइल डिसऑर्डर्स होते हैं, एंड वन ऑफ देम इज डायबिटीज. फ्यू टिप्स विच आई वांट टू गिव यू टू रिवर्स योर डायबिटीज और मेक योर नंबर्स बेटर इज, प्लीज डोंट गो ऑफ कार्ब, गो लो कार्ब. कार्ब इज द नेसेसिटी ऑफ योर बॉडी. वो कार्ब्स आप इंक्लूड करें विच आर हाई इन फाइबर, विच विल बी बेटर फॉर योर बॉडी. इसके अलावा आप भिंडी, it gives natural insulin to your body. So भिंडी का पानी, करेले का जूस, आंवला जूस. इसके अलावा one thing which I swear on is जामुन vinegar. Apple cider vinegar has become very popular. We all know जामुन is very good for diabetes. So आप जामुन vinegar with the mother culture include करिए अपने day to day routine में. उसके अलावा nuts and seeds which are unsalted, सब्जा सीड्स, ये सब आप इंक्लूड करें फॉर बेटरमेंट. इसके अलावा गुड फैट विच वी गेट फ्रॉम नट्स एंड सीड्स, एवोकाडोज और मे बी फ्रॉम घी, कोल्ड प्रेस कोकोनट ऑयल is very important for you to include in your diet. To keep a check on your protein intake which comes from plant based is also important. होता क्या है कि हम प्रोटीन पे ध्यान नहीं देते, हम फैट बंद कर देते हैं और हम कार्ब्स भी लो कर देते हैं. सो वी आर इनटू अ कंप्लीट मेस. सो नाउ यू नीड गाइडेंस टू कीप अ ट्रैक ऑफ योर कार्ब्स, प्रोटीन्स एंड फैट which you include in your daily day-to-day diet to keep a check and to reverse your diabetes. Inflammation, acidity, constipation are also few reasons of you getting diabetes. See, eat according to your body clock. हर एक घंटे में खाना है क्योंकि मुझे डायबिटीज है. प्लीज रिमूव दिस मिथ फ्रॉम योर माइंड. जितनी बार आप खाना खाएंगे, you are putting pressure on your pancreas to produce insulin. You are making it overwork. So eat when you feel hungry, when you need food and not according to your clock. उसके अलावा giving rest to your body, following the circadian rhythm, eating early dinners, giving a gap of 12 hours, 10 hours between your last meal and your first meal would help you to reverse diabetes. Include movement, keep a check on your stress levels and see the difference. Namaste.